President Trump just announced a $25 billion increase for the Medicare Advantage program for the 2026 plan year. Let's talk about it. But first, I wanted to let you know who I am. My name is Colin Wattenville, and I own an insurance agency based out of Omaha, Nebraska. We specialize in all things health insurance, which of course includes Medicare, all Medicare products. We're licensed in several states, representing about 300 Medicare plans in those states. But we also help those under 65, with marketplace plans, private options, as well as businesses. We help small and large businesses of any size set up group plans and benefits for their hardworking employees. But let's jump back to Medicare really quick. For those who don't know, Medicare is the federal government program, typically for those over age 65 and for those under age 65 who maybe have certain diseases, illnesses, or disabilities. And Medicare Advantage, the topic of this video today, is basically privatizing that federal program. So instead of the government accounting for and taking care of and facilitating these seniors' health insurance, what will happen is they say we can give X number of dollars to, I don't want to name any names, but said insurance companies are big ones, of course, out there that we're all probably familiar with. And you can, instead of getting the federal government program, take a Medicare Advantage program. And we won't go into all the intricacies or pros and cons of doing that. However, just know for the sake of this video and at the time of recording, about half of all people on Medicare have elected to do that option, the private route. They have a Medicare Advantage plan rather than having the traditional federal Medicare program. So that means, of course, that this is really big news. If half of people on Medicare have a Medicare Advantage plan, this is definitely pertinent information, seeing as the government is increasing spending for those programs to those private insurance companies by so much for the 2026 plan year. During the last couple of years, these programs, these Medicare Advantage plans, have actually seen price cuts and have not been receiving what many would consider adequate funding that keeps up with the rise of inflation or the cost of healthcare or the payment to providers and doctors' offices and hospital systems. So to see President Trump, and also by default the Centers for Medicare and Medicaid Services, also known as CMS, who is now led by Dr. Oz, actually, seeing the administration push so heavily into making sure that seniors are able to continue on these programs and these programs are funded properly speaks volumes, honestly. It shows that despite what you may or may not have heard, any program, any health insurance, of course, there's a lot of positives and negatives, and some horror stories get thrown around. But it looks like Medicare Advantage is here to stay. Again, as of right now, half of everyone on Medicare has one of these plans, a Medicare Advantage plan. And so having a backing by the federal government and the support to make sure that these people who currently have these plans, as well as those who might elect to take one of these plans during the annual election period in a few months, or during when they're first getting onto Medicare, having all the support and the extra funding really helps make sure these programs are stable, that the plans can continue providing rich benefits, making sure they can cover all the extra care that seniors need, making sure the drug coverage on the plans is adequate, making sure there's funding for extra benefits such as dental and vision, over-the-counter allowances to buy vitamins and supplements, things like that. As I mentioned, the recently appointed Minister for CMS, Dr. Oz, as well as the U.S. Health Secretary, RFK Jr., they both seem to be huge proponents of the Medicare Advantage program. Of course, this administration seems to be leaning more towards more options for consumers, which I think is always better than forcing everyone into the same box. But expanding funding to these Medicare Advantage programs at the end of the day basically gives those that have Medicare more options, more ability to shop plans and figure out a plan that's right for them, as well as continuing to see richer benefits for these plans. If these plans are better funded, then these plans can offer extras, gym memberships, dental, vision, over-the-counter allowances, and then of course ultimately make sure that our doctors are getting paid fairly for treating patients, making sure hospitals can stay open. I've seen so many articles this past year of whole hospitals hospital systems closing down or shutting down, or massive layoffs in the healthcare field, nurses, all sorts of craziness happening in the healthcare industry. So making sure the money is there to back up the people who are treating us, these essential workers, if you will, it's very important. So we'll see what happens during the annual enrollment period, which starts October 15th and runs through December 7th. For us brokers, we actually usually get to see what next year's plans look like around July, August, September for the next year. That's when the insurance companies have their plans pretty much finalized, and they start hosting events for us agents and brokers and agency owners like myself to kind of get a sneak peek of behind the scenes what the plans are going to look like for the next calendar year, to start making plans to see how we're going to be helping our consumers, see what changes are occurring, and try to get ahead of that so we are ready come the enrollment period time. But ultimately, I expect this to translate to better plans. Like I said, more benefits to consumers. For 2025, a lot of clients of ours, they saw some pretty big cuts to their plans. Plans no longer offering comprehensive dental, higher copays come up. A big one was higher prescription costs for the Part D side of these Medicare Advantage plans, for those Advantage plans that do offer drug coverage, which many of them do. A lot of consumers saw either some tier adjustments, so their prescription maybe went up a tier and they started paying more, or maybe the prescription stayed the same tier, but they now had higher cost sharing for that drug based off of the cuts that these insurance companies have seen the last couple of years. So looking forward to the 2026 plan year. Hopefully we see some of these benefits that were rolled back, added back in for next year. And overall, I expect a lot of our clients to be happy with the upcoming changes that are going to be happening to their plans. If you enjoy topics like these, if you like keeping up to date on the Medicare industry or employee benefits industry or regular health insurance industry, if you like hearing news, recent trends, updated articles, things like that, then give us a follow on your favorite social media platform and stay tuned for many more videos. Thank you for watching.